Right there. This is alternate.
Okay.
Hey, everybody, and welcome. We are here tonight. It is the 23rd of September. I can't believe it's the 23rd of September. It seems like New Year's was like 15 minutes ago. It's unbelievable how fast this year is going. And folks, I'm Kevin Gallagher. You're here at the second BioCare Hospital Round Table. And we have 4 doctors here with us tonight, along with myself. And we're going to get right into it. But just so you know who I am the CEO and founder of the Truth Be Told Radio Network. My name is Kevin Gallagher. And we've been on the air since about, let's see, it was April 10th of 2018. And we broadcast 24 hours a day. As you saw when we opened up the program, we have a bunch of different ways that you can actually tune in and listen to the program. And that includes all of the different smart speaker lines, the major ones anyway, like Alexa, like the Google, and also the HomePod made by Apple. That also works if you're using a smartphone. So if you have an Android phone, you can say, hey, Google, or okay, Google, and you can then tell it to listen to to bring up the network, and you're listening. You can do the same thing with your iPhone. You can just say, Siri, and then go right ahead and tell your phone to play the Truth Be Told Radio Network. And folks, that works in like over 80 countries. So you can try that today. You can try that when we get off the air later. We're going to be replaying this show at 1 o'clock on Saturday, this coming Saturday and Sunday. And then next Thursday, we'll be playing the show at 7 p.m. So, and that's, of course, Eastern time. So just adjust for the time zone that we're in. Dr. Rodriguez, he is the founder of the BioCare Hospital, and I love having him here as a host and getting his show out on the air so that we can really get some really great information about healthcare, your health, how to take care of your body, and those things. As we get deeper and deeper into this, it's going to I really do believe it's going to become more and more important. And so it's very important to me that we have these fine folks here for you tonight, where you can ask them questions, and you can do that through chat. We are broadcasting live right now. If you're watching on the 23rd of September, it's a little after 6 p.m. here on the East Coast. And we're here on our Facebook page, we're here on our YouTube page, and we're here on our Twitch feed. So if you have questions, feel free to, give your fingers a walking and type in the questions that you would like to have answered. So, Dr. Rodriguez, I want to thank you, and your doctors, thank you so much for being here. I'm going to turn the show over to you. And if you can, introduce yourself, please, in case people are not familiar with you, and introduce your doctors for us, please.
Okay, thank you very much. It's a privilege. I'm very grateful with you once again in setting up all these roundtables with the doctors, and it's very important for people to listen to this type of programming, because there's so many things that are happening in our daily life, in our society, health related, that can dramatically change the outcome of our lives.
Yes.
We work, we save, we plan, we do so many things to make sure that we're going to have a flawless uneventful life that's going to end with a good retirement, with traveling, with being with children and grandchildren. And all of a sudden, something can go terribly wrong because once you lose your health, nothing will be the same ever again.
Hmm.
So it's very important that we think of that because it takes a little bit of planning, it takes a little bit of consciousness, it takes a little bit of commitment to change all this, to bypass all this, to avoid going into a serious health issue that would dramatically change our life. That's what we're all about. That's what BioCare means. And I'm Dr. Rodrigo Rodriguez, and I'm the medical director of BioCare Hospital, which, as its name implies, works with uh, working along with everything the body has to defend itself, to be resilient, to be back healthy again when any health challenge happens. And it's important to understand that all we have to do is give our bodies the chance to do it. And I'm today with a group of doctors from BioCare Hospital, a staff that I couldn't be more proud of, uh, very competent, very skilled, very knowledgeable people with a lot of compassion, with a lot of heart, with a lot of understanding for what you, our patients, are feeling. So it gets to two things. Medical work uh, definitely needs both. It needs
Yes.
the skillfulness, but it needs the compassion and the understanding. And that can put things together in a way nothing can else. Let me start with the with two of our lady doctors. One is Dr. Melba Romero. She
No,
is a senior physician at BioCare Hospital. She's been working for us for many, many
no.
years, and we're very proud of having her. She's absolutely fantastic. She's a very good physician, very thorough, very everything, and uh, very competent. I mean, I have seen things that even watching what we do every day in the hospital, she has surprised me so many times very pleasantly because she says, well, what if, and bingo, she hits the point, exactly to the point. We have also Dr. Arteaga, who is much more recent member of the staff, but nevertheless, don't be fooled by their youth, by her youth. She is also very good, very competent. We discuss every day. We meet every day. We all the doctors talk every day. We have lunch together. We talk together. We eat the foods our patients eat, etc. We try to keep in real contact. And Dr. Arteaga has brought a new wave of imagination and of course different stamina and strength and many long working hours that many of us cannot do anymore. But she's been very good, very thorough. Patients love her, absolutely love her, and I really look forward for a very long stable work of Dr. Arteaga with us as it's been with Dr. Romero for so many years, and also for the other member of the staff that I'm going to introduce you, Dr. Vasquez. Dr. Javier Vasquez has been with BioCare Hospital for big number of years. He'll tell you how many years because I lost track. And you're going to see his patients love him, definitely. Even when they're on the phone, they say, I want to talk to him, I want his advice, I want his support. So we're very fortunate. And I could tell you that for every member of the staff. If we get compliments in this hospital from people, it's always about the quality of the staff. Because we look for people that have all these capacities, all these attributes that will make them a perfect team member for BioCare Hospital with skills, with knowledge, with compassion, with a heart, with understanding, because that is what medicine is all about. You have a health issue, and yes, you need help, but you also need a loving hand uh, helping you to go through this process. So that's who we are in this meeting, Kevin.
That's excellent. That's excellent. And let me just say this. T- Tell me, doctor, about why BioCare Hospital. I want to give people just a chance to hear about a little bit of the background of the hospital in case they haven't seen the other roundtables, in case they haven't heard your radio program that appears weekly, 7 p.m. on Friday nights and 9:30 in the morning on Saturdays at Eastern Time. Why BioCare Hospital? What makes you guys stand out from the rest?
Okay, why BioCare Hospital? It's kind of simple to answer. When you become a doctor, you want to be a doctor because you want to help people. I mean, I hope that everybody that goes to medical school has that in mind. I want to help people. I want to heal people. I want to bring them back to a healthy condition. I want them to pass through disease without much suffering and also reconquer health so they can go back to their normal lives and enjoy their lives and hopefully have a very long lasting life. But when when you do that and you start going to the real world, which is you see people that are sick, you see people that come to you because they are ill. You are in a hospital and you see this person in one bed, the other one in the office, the other one in an operating room, and you see everything that surrounds illness. And let me tell you, when you do all that, then you think, how can I help these people? And yes, you have laboratories and we have medication and you have etc. But I come from a world, because that is what medicine was about 50 years ago when I was in medical school. I was in medical school 50, more than 50 years ago. And people lived in a different way. People were fed in a different way. People grew up in a different way. And I saw all those changes happening with the type of food, with the type of physical activity, with the type of the chemical assault on foods, on
Yeah.
cleaning items, on everything surrounding your body. And not to mention, for example, cigarette smoking or alcohol, and foods loaded of very unnecessary, not only unnecessary, but also harmful elements. And then you think, what are we doing to ourselves? So you went to a hospital, and then we wanted to do something with the patient, let's say to fast, let's say an enema. You know, enemas were in the United States pharmacopoeia probably up to 1960s. They were a common modality of treatment. We don't do them anymore. Simple as bed rest.
Hmm.
When is the last time you got a flu and you spend the day in bed having chicken soup and your cup of tea? We don't do that anymore. We take a pill that makes us feel better and then we go on with our lives, or so we think. Because the truth is that when you do that, it's like if you have a fire at home and all you do is you remove the batteries from the fire alarm. So you will not listen to the alarm, but the fire is still there. And this has been happening with our people for many years, but particularly, unfortunately, within the medical world. We tend to believe that we can get away with everything we want and just live our lives the way we want and get comfort things and do and have fun, quote unquote, and and nothing will happen because if we get sick, we go to the doctor gives a prescription, and we get back on health. Think again. That does not happen. So we needed a place where I could have a patient that can have bed rest, that can have enemas, that can follow a diet. Food is so important. I could talk for hours about how food is, how is it relevant to health, to disease,
Yeah.
and to healing, and all those things. Unfortunately, you cannot get them in a regular hospital. I mean, anyone that has been in a hospital knows what hospital food looks like. So
Yeah.
I wanted a place where I could do what we needed, and this is back in the 1970s. And we decided the only way you can do it is you have a hospital where you can control the kitchen, where you can do the shopping, where you can get your fish, where you can get your organic vegetables, when you can choose what comes in and what never will come in this place. You do not want any processed foods. You don't want any chemicals in the food supply. You don't want any of that because that is not for human consumption, period. And we frequently forget that.
And that's excellent. And as far as diet goes, and I want to, get this out to all the doctors. As far as diet goes, and speaking from your field of expertise, what I'm curious about is what have you seen with the effect of food, in the American diet and the diet worldwide? Because what we're seeing, from what I can see, is you have a lot of ingredients that are in food right now that if I can't pronounce what's on the label, I'm not buying it. I'm not eating it. It's that simple. Um, and what kind of health problems do you see coming from these types of foods? You have GMO right now, you have all the chemicals, you have all the additives, you have the food colorings, you have all kinds of stuff that goes into this food now that we eat. And a lot of it is done, as we well know, is so that it can sit out on the shelf longer. So it doesn't have to get thrown out. So it maximizes that company's profits. And that is basically taken, over the health concerns of the people who's going to eat it. So any doctor that would like to jump in on this, have at it. How about you,
Okay.
doctor?
The
Go ahead.
diet, uh, the diet is actually something
Yeah.
very important in the lifestyle of every human being because it's something that we can control. What
Yes.
we put the food in our table is something that we can control, as well as the quality of what we're eating. As far as prevention, diet is very, very important, and it's something that we can control. That's why it's so important, and we can usually control it. That's what we say, but we're terrible. Patients, we as patients are terrible regarding the discipline of the quality of food and the amount of food. So
Yes.
but if we can only get into our brains that food is the diet is one of the things that we can control to prevent disease, I think we would do better if we
Yes.
could get
Absolutely.
that catch that idea. So
Yeah. Absolutely. And anybody else have a comment? Any of the other doctors?
Yes, I will compliment what Dr. Romero says uh, that
I'm having a little bit of trouble hearing you. You're coming in very soft.
can you hear me better?
That's a little better. See if you can jack it up a little more.
All right. What I want to say or compliment what Dr. Romero says is diet is very,
Yes.
very important. The body, what really needs is the raw materials to start repairing damage or problems, health problems. Uh, Unfortunately, the diet that we have available in these days is all processed most of the time, contains a lot of chemicals that definitely plays a detrimental role in our health. So by giving the body all the materials, raw materials, is like putting everything new in our body to absorb and get those nutrients into our system.
Yes. And one thing I've noticed, and I think we're going to be covering some of this tonight, we're looking at some of the aspects of cancer. And I mean, you're looking at in my wife's family, she had a young second cousin or something about 6 years old, 4, 5, 6 years old, and I forget the type of cancer, but it's the type of cancer that most people just don't survive. And you never saw, I mean, you go back 50 years ago, 60 years ago, I mean, you can correct me if I'm wrong. You know, you guys are doctors. Doctors would come from miles and miles away because a kid had a cancer, and it was like finding a 5-leaf clover. I mean, it just didn't happen. Now you have whole hospitals dedicated to treating kids with cancer. So, what changed? Is it the food? Is it something else? Because thankfully, my wife's young cousin, she has survived. She's made a full recovery, but I mean, she lost, I think, part of her part of her liver. I mean, she went through hell, and it was horrible for a little girl that young to have to go through that. No kid should have to go through that, Dr. Javier.
What I said before, the diet plays a major role in just not cancer. It's also as a preventive program.
Yes.
I feel that if we provide the body of all these good diet, we can prevent. This is one of the things, one of our goals, to offer not just cancer programs. We have a lot of patients that are looking for looking for preventive programs. Let me put this example. We have a lot of patients coming here for cancer or treatments or for chronic degenerative diseases, but also in the group we have relatives that come and ask for a preventive program because they are telling me, Dr. Vasquez, I don't want to go through this route. What I can do to help my body and prevent disease, especially cancer. So by looking all these problems that we're seeing, actually environmental pollution, poor diet,
Yes.
definitely I feel we can have a program that we can offer to prevent and avoid disease.
Absolutely. And Dr. Ortega, I wanted to get you involved in the conversation a little bit. Tell us a little bit about yourself and about cancer and some of these things that we're talking about in diet. Take it away.
All right, so I'm Dr. Noeli Arteaga. I also am an attending physician here at IBC. I always see it with my patients. They always want to know what to do after they go home and they're not in the program with us. Well, you mentioned food. So what's food?
Yes.
It's any nutrition that we absorb through our body, and then, it gives us that nutrient to keep growing, to continue to be healthy. But I don't think we're eating food anymore. It's more like processed substances that we're eating. So I agree with the other doctors. I think we need to go to the root, to the basis, try to eat as clean as possible, and try to look for local farms probably where they're not having all these pesticides into fruits, vegetables. Nowadays, they grow fish, salmon, so it's hard to also find just healthy growing fish or cows or poultry. So I think we need to stick with what we can find that doesn't have too many substances in the label.
Yeah, very much so. And I had a friend that he told me one time that you have an organic apple and you bought it at the store, but you have to be concerned about what happened to that apple. How was it shipped? Because he could take a beautiful red, beautiful apple and then take a bug killer and spray it all over it. And it's like, do you want to eat that apple now? I mean, no matter how much you wash it, do you really want to eat it? And it kind of put in my mind a different way of looking at what kind of food do you really want to put in your body? You know what I'm saying?
Mm-hmm. Exactly. It's kind of hard to know what to do because we need to eat, right? That's our
yes.
That's our gas. There's our gasoline every day. But I think we can certainly try to see what we can try not to eat or what we can. Sometimes our lifestyles are very busy. We need to do a lot work a lot of hours, or some others they don't have time to do their own food. But at least try to not to go with the processed food, like fast food.
Exactly, exactly. What I'd like to do right now is jump over to Dr. Vasquez, and I know you want to talk about some things having to do with prostate cancer, and for a man, that's something that is very frightening. You don't want to hear that you have prostate cancer as a man, and what are some of the things that people should know about with this as far as early detection, treatment, and whatever else you want to add?
Okay, certainly talking about prostate problem in men is as an important as talking about early detection of breast cancer or cervicouterine cancer in women. Um, Let me start by saying that the prostate is healthy in younger men, but as the man grows older, the gland suffers some changes that eventually can turn into three different conditions of the prostate. Number one is prostatitis, which means a prostate inflammation.
Okay.
Number second, to a benign prostatic hyperplasia. And number three, to prostate cancer. Prostatitis is an inflammatory process that can cause painful urination that usually is accompanied by burning sensation or by a strong urge to urinate.
Hmm.
In benign prostate problems, here the key is enlargement of the prostate. These changes of the enlargement of the prostate are not going to happen uh, from night to overnight. Usually, it's a slow process. And by age 40, most of the men can experience some progressive urinary discomfort, which needs to be checked as soon as we have these problems. Uh, by age 60, most of the American men will have microscopic signs of benign prostatic hyperplasia.
Hmm.
And by age 70, more than 40% will have an enlargement that can be felt by physical examination.
Yes.
Uh, for this reason, it's very important to check these symptoms and go to your local with your urologist
Yeah.
just to be checked. Prostate cancer is actually is a slow form of cancer, different from other ones. By age 50, most of the patients will have some symptoms related to histological symptoms related to some prostate changes. And by age 75, definitely we are going to have some cancer cells, but unfortunately, as the prostate cancer, does not give too much symptoms, most of the time cannot be diagnosed properly. For
Hmm.
this reason, when you start feeling the urge to urinate, when you have dribbling, when you have rectal discomfort, you have to go to your doctor and have uh, a physical examination that will include a rectal examination of the
Yes.
prostate.
Yes.
This is the key. If the examination reveals that you have an area suggestive of a hardening in one or two lobes of the prostate, your physician will send or complement your evaluation by requesting ultrasound of the prostate. This also requires basic lab work called PSA, which stands for prostatic antigen. Uh, Usually, in patients, let's say age 40 to 60, PSAs can be between 4 to 5 nanograms per milliliter. When we have readings more than 5 associated to a digital examination of normal and to sonographic changes suggestive of calcifications in the prostate, definitely the doctor will request a biopsy. This is the way that usually you diagnose prostatic cancer.
Yeah. Now, is there things that people can do, like a man? Is there something a man can do that can help prevent? Is there preventative type of things that a man can do to prevent this from ever happening?
Well, we do recommend dietary changes, especially the use of lycopenes, the use of antioxidants. If we found that we have an enlarged prostate, but not a cancer, we do recommend saw palmetto and other supplements that can be beneficial to help reduce inflammatory process on the inflammatory process on the prostate. Uh, but we had to check, we had to keep the eye on this problem constantly because uh, the main parameter that is going to be the indicator where the prostate problem goes is the PSA. And of course, your urinary symptoms. If the urinary symptoms are progressing and
Okay.
you're not having any response to the dietary changes or supplementation, uh, this is when I do recommend to do more invasive diagnostic tests like a biopsy.
Exactly. Okay. And what happens if somebody they get diagnosed with this condition? What's the best thing they can do? What are the steps they should take?
Well, the reason why we're here is because we want to plan a program, what Dr. Arteaga says, that
Yeah.
goes to the root of the problem, to do the changes that you need to reverse this process. I'm not going to ask you to come and have radical treatments here for radiation or chemotherapy. We like to do integrated program, and those programs start with a good diet, supplementing your body, programs that will help reduce inflammatory process, and of course, the diet that has to be totally organic. If we do these little changes, definitely we can help the problem. Now, I'm talking about issues like prostatitis and inflammatory conditions of the prostate. But if we do have a confirmed diagnosis of prostate cancer, we can add other therapies like whole body hyperthermia, which is a treatment that we offer here to help attack the cancer. Of course, a program that is an immune booster with using vaccines created with your own white cells, the dendritic cell
Right.
vaccines, and many other things.
Excellent. And Dr. Rodriguez, I know Dr. Vasquez had brought up something about supplements, and I know the ad that runs on the network, you talk about the supplements that you offer, to the public. What is different about the supplements that you offer, and talk a little bit about the integrative process.
Okay, the first thing I would like to say is that I'm not saying it. It's been said by, for example, the CDC, Center for Disease Control Disease in Atlanta, which is a major health authority,
Mm-hmm.
that about 30% of the most deadly diagnoses in America can be changed by simple lifestyle modifications. Dr. Romero was saying it very well. Food in our mouths, food in our table is a totally controllable factor.
Mm-hmm.
We all, and this is to me one of the most important things to try to use as a message tonight. We have to understand that without our participation, the success of any health therapy is going to be limited. We have to be a part of it. We cannot go to the doctor and hope the doctor is going to cure us. Think again. I'm going to mention some of the most deadly diagnoses in America, beginning with the number one killer, which is heart and vascular disease.
Yes.
The second, cancer. And then you go on with a variety of things that you don't want to talk about, you don't want to see near you, like high blood pressure, like diabetes, which is rampant, obesity, metabolic syndrome, Alzheimer's disease, neurological disorders. I'm telling you, the most important diseases today, which are going to kill 7 out of every 10 of us, are diseases that we are producing ourselves by the way we handle our lives. It's very important to understand that we have to stand at the helm, hold steady, and take a direction. And unfortunately, when we talk about all those things, we have to say that the food supply that we have today is not what we had 50 or 100 years ago. Our foods are depleted. They don't have
Yeah.
everything they should have. So, depleted foods mean depleted bodies. And we are depleted.
Yeah.
And one of the big strengths of BioCare Hospital is that we are going to find what deficiencies, what nutritional deficiencies this person might have. And we're going to say, well, now we have to target our supplementation. That's probably what makes us different. That we're not going, I don't believe in multivitamins because you don't have to take them all because you might come from Alaska or you might come from South Carolina where dietary supply is completely different.
Yeah.
So I have to analyze every person and say, I'm going to target this deficiency and I'm going to supply it immediately. If you come to BioCare Hospital, you're going to see that many people will have an IV drip. Why? Because intravenous targeted supplementation is very efficient. I can put in your body today, right now, the amounts of magnesium or calcium or vitamin B or anything your body needs for sure, because I'm going to be bypassing the ifs and buts of good digestion or good absorption, which is another big component in today's health issues. We have a completely distorted uh, intestinal flora. Why? Because we eat very bad. I hate to use the word diet because it implies two things that shouldn't happen. One, that it is a sacrifice. Second, that has a limited span. And I don't believe in any of those things. I think food should always be pleasant.
Oh,
And we go a
absolutely.
long way to create a food for our patients that they love, not only love, but can take the recipes because they will continue doing it. And second, because it is for good. I, I heard once a doctor that said, how long am I going to eat this food? And he said, for as long as you want to feel well. It's
Yeah.
that simple. We have to change our ways and we have to admit that we eat with a purpose. And that's the only thing I ask people. Every time you're sitting on the table and you're about to eat, you have to think, why am I eating? Am I eating because this is good, or am I eating because this is good to my body? This is good to everything I want to accomplish. Like, for example, we were talking about prostate. Well, if you reduce fats, particularly the type of vegetable fats that we're surrounded by, because we eat a lot of fried food. Fried food should not be for human consumption. I mean, you can have it on New Year's if you want to, but we shouldn't eat fried food. We shouldn't eat the amounts of fats that we eat. And fats are everywhere. They're in cookies, they're in ice cream, they're in salad dressings, they're in mayo, they're in everything.
Yep.
I mean, if you look around, we are eating probably 10, 20 times as much as vegetable oils as we should be eating. And on the contrary, we're neglecting omega 3s because we don't eat fish, because we don't eat raw nuts. What I mean by raw nut, I mean you have a nut in the shell, you crack it, you eat it. No, people buy it in a can or in a bag. The omega 3s have been oxidized.
Hmm.
You're eating calories, you're not getting nutrition. And on top of that, they might be roasted with, again, with vegetable oils and with a lot of salt. So we just have to look around and be conscientious about that. And then when you go through a program like ours, then you're going to see what you're missing. We replace that. And when we choose our suppliers for, for supplements, we make sure we have ethically processed supplements. In other
Yeah.
words, they have the quality and they have the quantity. Because many times you go and buy vitamin D, so many units, and it might not be true. So we make sure that if you're having one of our products, you're getting the milligrams, the units that we put in that table.
Yeah, excellent. And what I'd like to do is talk to Dr. Romero and bring her into the conversation. You know, breast cancer is something that hits close to home for me because my grandmother died of it. I was 14 years old. Something I'm 57 now, and I still, when I think about it, it gets me a little upset because I watched how she passed, and it wasn't very nice. It was pretty bad. And the thing that I have found about cancer in general is that it tends to really rip the heart and soul of that person out before they ever die. And I knew at 14 that when my grandmother passed, she was already gone, and I wasn't looking at my grandmother, and that upset me quite a bit. You know, and when you're looking at things like breast cancer, one thing that I had found with a friend of my mother's and father's, he actually came down with breast cancer, and I didn't know that was possible for a man to come down with it. So I found that very interesting. And it seems like the number of cancers, whether it's breast cancer, prostate, whatever, it seems to be going in the wrong direction, which is up. And that's not very good. Um, what are your comments about that? And what are your thoughts about what I just said?
Well, regarding breast cancer, breast cancer is it's one of it's a very important diagnosis to address and a disease to be addressed in nowadays because breast cancer is 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 the most frequent cancer actually.
Hmm.
Just trailing in a little bit in front of lung cancer.
Yeah.
Skin cancer obviously is the most frequent, but it rarely kills a person.
Yeah.
But breast cancer is the most common type of cancer, and according to the National Cancer Institute. Uh, why do they say that it's the number one cancer? Because it's the cancer that's being most diagnosed most every day. And maybe why is this? Maybe because there's a lot more awareness. There's a lot of ways on how to detect it early.
Right.
And so we're diagnosing it very frequently, more frequently. 99% of breast cancers affect women, and 1%, as you said, affect men.
Hmm.
Breast cancer has um, a certain particular detail in the way that it doesn't necessarily have to kill the woman. And that nowadays less people are dying from it with the early detection and all the treatments available. And as I said before, it's interesting because you can actually take control of prevention of this cancer. There are certain things that happen with uh, to the person who has breast cancer. Factors that can be genetic. The genetic factors cannot be changed. You know, the genetic factors are if you have uh, uh, a first degree relative that has had breast cancer, you have a higher risk.
Hmm.
If you had children older than 30 years of age, or had no children at all, or did not breastfeed, your chances of having breast cancer are also
Huh.
increased. So those are things that factors, important factors in developing the disease. But there are a lot of other factors that can actually that are in the patient's favor, like as we were saying before, the diet and exercise. Diet. We were speaking a lot of diet.
Yeah.
I am a very strong believer in that the first line of defense is the intestinal flora that starts in the mouth and continues all the way out.
Hmm.
So let's work on that. Let's feed our intestinal flora. Let's be preventive with that, proactive in that area. And how do we do that? With healthy diets. You know,
Yeah.
go eating like we would be eating 150 years ago. A lot of nature food. That's what we should eat, and that's one thing. The other is move. Exercise. Exercise is the only one factor that is very well known that will rejuvenate our bodies, that will rejuvenate our immune systems. Because actually, the aging of the immune system is a factor to develop any disease, but especially cancer.
Yeah.
So what can rejuvenate our immune system? Walk, at least 3 times a day, or run, do some kind of an exercise, move. That is very, very important to keep our immune systems younger. Uh, 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 e- uh, Maybe the same way as the diet, as feeding your intestinal flora. That's very important.
Yeah.
Other factors that we can also control is our body fat, our body weight. More than the body weight is the body fat, because if our fat composition is higher than what it's supposed to be, then we have a factor for cancer, for any type of cancer, especially breast, which is the most common one. And so that is something that we can control. And I was saying body weight because if our weight is more muscle, then we are a lower risk for cancer. So that's an important detail to take
Hmm.
in account. And
Now,
and
let me
I
ask you a quick question.
Mhm.
You're saying that there's a connection between gut health and, for lack of a better way of putting it, gut health and cancer in general, correct?
Yes, for
Yeah.
that and for any disease, even for depression.
Hmm.
People don't feel like depression is a disease, but it's a very important disease nowadays, and it's related to the dysbiosis, what is called dysbiosis, chronic inflammation of the colon, colitis, irritable bowel syndrome, malabsorption syndrome. All of that, they're very much related to the intestinal flora, to what is called dysbiosis. Dysbiosis is a diagnosis. The people that eat and feel terrible, and they blame the food that they're eating, but it's probably the combination of foods or the quality of foods, and obviously the emotional stress is involved. And are they really active, practicing an exercise? That's very important also. And so there's a lot of factors that contribute to the intestinal flora. And we now know that we have more bacteria in our bodies than cells.
Hmm.
So imagine there's a certain type of bacteria here,
Yeah.
proper for this area, for the ear, for the mouth, for the esophagus, for each in every area of our bodies, there's a certain type of bacteria right there.
Now, is
What
it true? Is it true? Because I had read somewhere that if you didn't have certain types of bacteria, for example, in your skin, you wouldn't stay alive very long because it acts as a
exactly?
first line of defense. Is that
Of
true?
course. Of course, it's true.
Yeah.
Yes, yes. Probably
Yeah.
not necessarily that you're going to die, but you will be ill all the time.
Yeah.
And you know what? The this I think that this bacteria situation, healthy flora, is so important, especially because we're alive.
Yeah.
Staying alive means getting older, and getting older takes us to the reason why hospitals like the ones that we work in exist.
Hmm.
I think I mentioned it the last time that we can we have an oil change in our cars. We need to watch the amount of water that they have water that
Yeah.
go to service. You take your car to service, right? In
Right.
our bodies, we hardly do anything to them. We always feel that it's too expensive to buy a supplement or to buy organic foods or to spend money, I don't know, in some kind of physical exercise class or something like that, which is actually we're making a wonderful investment. Paying for a program in our hospital, I think, is the best investment that we can do. Why? Because aging means equals a pro-inflammatory process, a chronic pro-inflammatory process with the absence of active infection. Uh, Being alive means being inflamed all the
Yeah.
time.
Yeah.
So we can always go ahead and do things to decrease that inflammation. And what can we do? Intravenous vitamin C, by example, um, can produce an important anti-inflammatory effect. The patients always say, "I feel better already after the first IV." And many years ago, I would say, "Oh, they're crazy. It doesn't act that
Hmm.
fast," but it really does. It really does. So an IV with a certain amount of vitamin C will make it can make a difference. Just one, or an oxygen therapy. Oxygen is life, so if we do like a session of hyperbaric oxygen, can make a difference in a chronic pain. We will notice a difference.
Hmm.
If we suffer from chronic inflammation in the or edema, swollen feet, things like that, infrared sauna, by example, will relieve it in a matter of 2 or 3 days. So there's certain things that are non-invasive and that we can invest in creating that contributing to a dignified and healthier aging
Yeah.
process. But we must remember, keep it in our brains. Getting older is being inflamed. We're going to be
Yes.
inflamed as we get older, and our immune systems will not get younger, they will get older. We know that they're called epigenetic factors. Epigenetic factors are age, diet, exercise, the amount of activity, exercise. Why not the intestinal flora? These factors are called like that. Why? Because they don't change the DNA. They will not change the DNA, but they will activate or deactivate certain genes in our bodies that can trigger specific diseases. And we will not see a change in the DNA, but we will see activation of genes. And that's what diet and exercise do. They activate or deactivate, let's say, benign or malignant genes, depending on what
Yeah.
the genes, what the information for a certain disease on our genes we were born with.
Hmm.
So it's important that we invest in our health. Um, in very simple programs like the ones that
Excellent.
we have to offer with us. And obviously, we have the programs and we have the knowledge the knowledge up until now, because we're not the owners. So, well, we don't know everything. There's a lot more to be um, known, but we can certainly give a good advice to our patients.
Excellent. What makes the treatment there at BioCare Hospital different in the sense of cancer than, say, a different hospital,
It
or
depends.
maybe a more
It,
traditional one?
it depends on the type of cancer, the stage of the cancer, in the recommendation that we will give, or the suggestions. We have like a general program that holistic, because it treats the whole body,
Hmm.
uh, in focusing in detoxification, intestinal flora, oxygen therapies.
Yeah.
And as I said before, oxygen is life.
Yes.
Oxygen decreases inflammation. The diet,
Hmm.
definitely the enemas, the intravenous infusions, all of that will create a better environment for our good genes to take over. So
Excellent.
that's
Excellent.
what our treatment is based on our natural, taking advantage and activating our natural resources, creating
Yes.
the best environment for that. So that's what our treatment offers. We're not against chemotherapy in certain cases, or radiation or surgery, because we know that sometimes those procedures are very necessary, but there's something that needs to be complemented, because with surgery, radiation, chemotherapy, you're just treating the symptom, what you see, the tip of the iceberg, but there's something more important way down beneath, and that's what we need to complement with
Yeah.
our therapies.
So you're talking about treating the cause, not just the symptom.
Exactly, which is
Yeah.
yes, very
Yeah.
important.
Yeah, okay. And so let me do this. I'm going to shift gears and we're going to talk to Dr. Ortega. And it kind of is a good shift because you had brought up, there's a lot of these chronic conditions that I see all the time talked about, doctor, when I see it in the news, whatever, people talking about their metabolism, diabetes, hypertension. I mean, I hear it all the time in the news. There's not a day that goes by I don't hear something in the news that has to do with diabetes. I hear about hypertension. I hear about these things. They're talking about it all the time. And so, what are some of the things that people can do, number one, to, find out early if they do have a problem with this? What are some of the best things that they can do, and what are some of the things that BioCare Hospital can offer them?
All right, so I'm going to compliment also Dr. Romero about the gut health.
Yes.
I think there's the where we need to begin with. All these diseases, including cancer or metabolic syndrome, hypertension, diabetes,
Yeah.
all things come along from the same basis or the same root, like I said before. Um, Being under stressful situations can lead us to certain inflammation. Inflammation can lead to, example, diabetes.
Yes.
But we also have some other risk factors. It's not just being or doing certain things. Um, what is what we can do? Well, I think exercise should be the first thing. We need to move more. Sometimes we spend too many hours sitting down in the office, not moving, just writing down, or not try to move 5 minutes, then again go to work, and then stand up, move your legs, move your arms, walk for minutes. If it's possible after work, do some other walking or
Yeah.
another kind of exercise. Also, well, diet, like we've said since the beginning. I think we need to know if we're going to eat that, because it, like Dr. Rodriguez said, if it's good for us or it will be a nutrient. But of course, preventing this, we will need to have a healthy gut. So encouraging to have or to be under a program with us, I think we promote a lot of that. Everything we do is also to increase our gut health, and then that with that we will get better nutrients and will have decrease inflammation. Complementing with the gut health, I will also would like to talk a little bit of colon cancer. Sometimes those changes, those bowel disorders that we have, chronic inflammation, colitis, can lead us to colon cancer. Colon cancer is a cancer of the large intestine, and the approach, it will be about, trying to do what doctors said about breast cancer and prostate cancer. Changing the lifestyle, diet, exercise, and everything starts with our mouth, technically.
Yeah, it's interesting because with cancer, there's been a history of it in my family. And so, for example, my dad survived the two cancers that a man usually dies from. He had colon cancer, but first he had lung cancer. And the weird thing is that him and one of his sisters both had the exact same type of cancer. It only shows up, I forget the name of it. It's got some long name, but it only appears in like 1 out of every 250,000 cancers. And this cancer would like metabolize in like one area in the lung, and then it would grow from there. It wouldn't spread and go out to all different places. So he had one of his lungs removed. It's the smaller of the two. And then less than 6 months later, I think because he was basically a hypochondriac, he wasn't really feeling all that hot, and they had checked him, and he had the colon cancer. And they removed like 6 inches of his colon. He was fine after that. But, the early detection and everything, that's what saved his life. And I remember seeing him suffer with that. It wasn't a lot of fun. So early detection is always the way to go. And to stay with you, we're talking about that colon cancer you brought up, and also diabetes I'd like to touch on, because I have a friend whose young son, 12 years old, 14 years old, was diagnosed with type 1 diabetes. And you see it constant. It's like everywhere. It's like another person that comes down with diabetes. It's like, it's so rampant. And I remember growing up as a kid, I knew 1 or 2 people, and now I can count, all kinds of people I can think of that have some form of diabetes. And what's causing, those numbers to go in that direction, doctor?
Well, lifestyle mainly.
Yeah.
Our lifestyle has been changing among the years. Nowadays, kids don't go out and play. They just stay home rather and play video games. So they're sitting down 6-7 hours instead of going out and moving themselves. Also, if you go to a store, what you will find is a lot of, candy or sugar food.
Yes.
So everything that goes into our bodies, and high levels of sugar all the time can lead to diabetes in a certain age. Pregnant women that are, have this genetic tendency to have resistance to insulin, they will, pass that to the child, and probably that's why we're seeing children born with diabetes already, or having to start with diabetes at early age.
Yes.
So we've been probably repetitive about the things that we must do to change this, but diabetes has been one of the most it's not just breast cancer that can rip our heart, because I've known also in my family, diabetic persons, they don't die just from one day to another. It's a chronic illness, and depending on how you manage the disease, you will start to develop some other consequences of the disease, like neuropathy, bad circulation, that will lead to not being able to walk, a stroke, some other issues that will attempt to be healthy, and you will need to be having some other family members taking care of you. And it's not a disease that you you must be on your own. So
Yes.
I think we need to focus on what we eat and try to do exercise as much as possible to try to decrease the amount of people that get diagnosed with diabetes.
And I got a question that came in with the hypertension. So you hit a nerve. What they're saying, what is the best way to treat hypertension? That's what they're asking. And so, what would be the answer to that question?
Well, there's certain stages of hypertension. Some people they're hard to control their blood pressure, but of course, doing exercise will lead to a better or a healthy heart. Another way of doing it is a diet. There's the DASH diet or Mediterranean diet. So
Yes.
we're also focusing on the same. Try to eat whole grains. Stay away from beef that it's pro-inflammatory. Go more with omega-3s that we can find in salmon or other fishes. Do more vegetables. Do more fruits. Stay away from fat foods or processed foods.
Yeah.
Sometimes we see zero trans fat in the label, but they're charged of carbohydrates or sugars. Or we can say that it's sugar free, but they're charged with a lot of fats and not just the good fats. So remarking what Dr. Rodriguez said, we need to eat raw nuts like almonds, walnuts. Those are the good fats that we are trying to look in the diet, and we'll stay away from fried food and sugars.
And sugars. Now, what I'd like to do is I had saved up a bunch of questions that had come in during the show, and I wanted to see if I can address this out to the group to see what you guys had to say. I had one person that wanted to know more about what they could do with ITP, what was the best ways that they could address ITP. I'm not even really sure what that is, but who would like to answer that question out of the group? How about you, Dr. Rodriguez, with ITP?
Well, I have the same problem you have. I know that in America, abbreviations are very common, but I'm not sure exactly what we're talking about.
Okay. I wasn't sure what that was either. And also, the next question that I have is a person has a bubble on their aorta, so they wanted to find out some advice on what they can do to treat that, I guess, and get some advice about that.
It depends on what is the size. This is a problem that's not unheard of, unfortunately, that is telling us about the quality of the blood vessels. It means that the aorta has been damaged through inflammation, through fats, through deterioration and degeneration of the covering of the inner lining of the aorta, and that produces, like one of those old hoses we have at home when you have a very old hose, that it makes like a balloon at some part that can be just fluffy. Sometimes it can be bigger, and that is what is called what is produces this type of thing. For some people, it's very painful, and in some people, it's kind of manageable, and it can get to the point that it could break, in which case they will either put a stent or just remove part of the blood vessel to put a graft. Those are the things. It can be, if it breaks, it can be very serious. Now, what you can do, again, reduce inflammation. There are a couple of things that we've been talking about over and over again. We've been talking about aging. We're talking about that aging brings inflammation. And we're talking about that all these conditions will lead to disease.
Yes.
So what we have to do is we have to be careful. And of course, we cannot change aging. We're going to continue to age, but we have to change the consequences of aging by reducing the amount of swelling, by reducing the amount of inflammation in our body. That's number one, and by creating a stronger, more resilient body to fight off health issues. Because remember that all the diseases that we've been talking about tonight are diseases that we produce ourselves.
Yeah.
We're not talking about a virus or a bacteria or anything like that. It's a disease that originates and it's
Hmm.
created in our own body by something that's failing. And then what we have to do is we have to change the conditions of the body so the body doesn't do what we don't want it to do. So, in talking to this particular case, this person has to reduce fats. The less fats the person eats, the less fat anybody can eat, the less inflammation you're going to have. The more you
Right.
move, the less inflammation you're going to have. Let me tell you something. There is a very important study that has been done in University of California, San Diego, that shows that many people are taking their anti-cancer therapy, and all of a sudden it stops working.
Hmm.
They say, why this drug that was doing well stopped working? Because inflammation went up for whatever reason. So if a person develops a higher inflammatory markers, then the therapies they were getting are going to become more and more
Yeah.
inefficient.
Unuseful.
So, and many times just by reducing inflammation, therapies work again. Now,
Yeah.
this has been proven by studies that show that cancer patients that have a better physical activity patterns live longer than those that stay in
Yeah.
a couch or in a bed. So I know it's hard to say, well, I have cancer. I don't feel like going out. I don't feel like doing anything. But there's so many very simple things to do, like take one step up, one step down, one step up, one step down. You can put a box. You don't have to have a stair. You just can put a box, go up and then go back, or go up and you go back several times a day. You can move. You can walk around. You walk around your bedroom. Walk around a simple place. I
Hmm.
encourage people to, for example, if you go to the supermarket with these huge stores that we have today, that are completely flat, well lit, air
Yeah.
conditioned, and so forth, walk around the whole store. They're so big that I guess you can make a couple of miles in a couple of turning around the store. You see what's in the store, you can have fun, you can meet friends, and at the same time, you're walking. You don't need any
Yes.
shoes, you don't have to jog, you don't have to run, you just have to keep some physical activity. And there's a study in Britain that shows that one of the best exercises you can do is vacuum clean,
Really?
believe it or not. So
Really?
it makes sense because you're moving one direction, then the other
Huh.
direction, and then you go forward, then you
Don't
go
tell my
backward.
wife. She'll make me vacuum clean like crazy, you know?
You see, and it shows, and it's amazing because when they did this study, they took some people to the gym, and they
Yeah.
put a personal trainer, and then they followed all the parameters to see who
Yeah.
did better. And the people that were vacuum cleaning were doing a lot better. If
Hmm.
you move the furniture when you're vacuum cleaner, it's going to be even a lot better. So you don't have to go out of the house. You don't have to do anything. Uh, and that's probably why in the older generations, people were healthier because they use a broom, they use a mop, they used they did the laundry by hand. They did so many things. They walked out, came back, they did errands. We don't do any of those things. So
Yeah.
let's be in more creative.
Yep.
Let's make sure that we're doing this because that's going to reduce inflammatory markers, and that can make a big difference. Now,
Yes.
there's another simple test. You do not need a lab. You do not need a machine. You do not need anything. all you have to do is check your waist size. Every man, every lady knows what's their size.
Hmm.
With men, pants. With women, dresses. And if you are size 8 and then you went up to 10, you know you have to do something to go back to the 8 you used to be.
Hmm.
If you have a waist size, and I'm sure I know very well, I know what was my waist size when I was in medical school. And then you say, well, if I was this size and now I'm 4 inches bigger, it doesn't take it's a no-brainer to say I'm not going in the right direction.
Hmm.
So all you have to do is get dressed every day and say, "Mm-mm, this is beginning to be tight." And the most damaging fat you can get in your body is around your waistline because it has a pro-inflammatory hormone production. So you don't want that fat. You can be heavy, but your waistline should be in better shape all the time. We all can afford to lose some pounds, and we know that. So let's do it. Let's get at it, and again, get at helm, and we're going to begin controlling diseases. Now, the intestinal flora is of critical importance. Dr. Romero was talking about depression. Depression is the number one diagnosis in neurological disorders, the number one diagnosis in America.
Hmm.
And we all have heard about hormones that can make your brain function better, like serotonin. Well, serotonin, which is one of the most important hormones for the brain, for well being, is produced in the gut by the intestinal flora. We don't make it, it is made by our intestinal flora. See, if our intestinal flora is not working properly, then we have a problem. Now, how
Yes.
we know we have a problem? Because we're constipated, because we're bloated, because we eat and feel bad. And people say, this food does not agree with me. No, it's your colon, the
Hmm.
problem, and you have to begin working on it.
Yeah, absolutely. Now, the thing with the vacuum cleaning is nowadays they got the robot vacuums, and that's not going to do you much good.
No, no, no way.
That's not going to do you much good to say, "Hey, Alexa, vacuum the floor." That's not going to work. But just a little levity there. We had a lady who's watching in the UK who agrees with you about the vacuum comment, so I got to bring it up. And out in England, so hello, Maria, watching in in the UK. We sure do appreciate it. What I wanted to do was I had another question here about what they can do to help with their knee pain, and what are some things that people can do to help with knee pain? I think this person said that they have it in knee pain in both knees. So what doctor would like to comment about this? I'm
Uh,
going to pick on somebody. Dr. Vasquez?
yes. First,
Yes.
first of all, I would like to know it is the age of this patient.
That I
Like
don't know.
anyway, knee pain can be triggered by inflammatory condition, and this can be due to overweight because aging process in the joint, degenerative
Okay.
process. Uh, it is important to have always an evaluation, a medical evaluation on that knee to through a plain X-ray to see the images that we can obtain from there and pinpoint to the root of the problem. Inflammatory conditions can be autoimmune affecting the joint, can be a degenerative process because physical activity, uh, postural changes, many things like that. Uh, Management usually, of course, we talk a lot about diet. Reducing weight will be very important for these patient if he's
Yes.
overweight. Reducing the weight put less pressure on that joint. Using the diet anti-inflammatory type that also will help. The use of digestive enzymes can help. The use, if needed, of anti-inflammatories can help. But if we uh, obtain the images, or we have more information about this, the use of stem cell therapy can be also a very helpful therapy for this, because the stem cell therapy actually can help to reconstruct damaged areas into the joint. And this possible can help the patient avoid other type of more invasive treatment like surgery.
Right.
So this definitely will start by step A, step B, C, and D. And this is going to start by doing the diet, reducing the weight, and so on.
Excellent. And Dr. Rodriguez, I wanted to come back to you for a little bit here. You had wanted to talk about a couple of things here: depression, anxiety, hyperactivity, and Alzheimer's. And I thought maybe we could touch first on the Alzheimer's, because that's something I've also seen kind of go in the wrong direction, just going straight up like the space shuttle. And why, and that I'll also add brain fog. You see a lot of that, and I don't know how closely related that would actually be to, say, Alzheimer's, but I've seen over the years that that number of people that have Alzheimer's seems to be increasing and increasing and increasing. So what are your thoughts on this, sir?
Boy, you have really put it, I couldn't have said it better. I think it's skyrocketing. When I was in medical school and you wanted to play with somebody, you would say, hey, I saw that the examination will talk about Alzheimer. And people would say, about what? And
Yeah.
people, I mean, we used to tease people about something they didn't know, because it was a virtually unknown disease. It was a medical curiosity. That's 50 years ago.
Yeah.
Today is the sixth cause of death in the United States, and one
Didn't
of the
know that.
most important neurological uh, problems. It's growing in a very dramatic way. There are many theories about it. There are many theories about what it could be happening, and they talk about amyloid deposits, and they talk about different theories. But what is very evident is that people with Alzheimer's begin with chronic inflammation of the neurological tissue. And this
Hmm.
chronic inflammation is produced by antibodies anti-sugar components.
Huh.
Okay, so you start getting the two together. Once
Wow.
again, are we talking about a sugar produced disorders? And it's becoming so important that some people start talking about diabetes type 3. Diabetes type 1 is like the boy you were talking about, a young
Yeah.
person that all of a sudden gets diabetes because the pancreas does not produce insulin and they are insulin dependent. The diabetes type 2 is the most common, which is the adult type of diabetes that you can take some pills, go on a diet, and help. And third might be Alzheimer's.
Mm.
In any way, the countries that are looking at the biggest growth in numbers of
Yeah.
Alzheimer's are places like America where we eat a lot of sugar. I'm going to give you an example. If you go to Japan, for example, and there's a medical specialty, a dental specialty that we call endodontia. An endodontist is a man that kills the nerve in the teeth so it doesn't hurt. So if it has tooth decay or anything like that. Well, in Japan, they barely exist
Hmm.
because children do not eat any sugar.
Huh.
So we are having some. I would invite you to read the labels of food. And you can buy soup, and you're going to find sugar in it. You can buy a stew, a beef stew, and it has sugar in it.
Hmm.
We use it in so many things that we're virtually assaulted by sugar in our diet when we read the labels. By the way, on my desk, I always have a basket of apples. And when I'm talking to people, when I'm talking to patients, and we discuss things like this, I normally tell them, I take an apple and I say, uh, can you read the label on this food? And they of course smile and say, no, there's not a label. Then go ahead and eat it. If
Right.
we have to read a label, we should probably avoid it. I went recently to Alaska to to a conference that I was invited to, and I found an organization of local growers and local distributors of food produced in the Kenai Peninsula. And they had like almost 20 suppliers.
Hmm.
And to me, it was real source of inspiration. We have to get together now with social media. We have to get together and say, hey, I have some potatoes that were grown locally. I have this type of food. I have fermented foods, which, by the way, fermented foods are great for the intestinal health. So
Yeah.
you can look for different things that might be 2 blocks from your house.
Yep. Yep.
Yet we are buying sometimes a food product that has been shipped from 2,000 miles away, where we have a much better product several blocks from our home.
Hmm.
So it's very important that we start looking around. To me, the moral of the story is let's jump at the opportunity to modify what is within our reach. And that's the food we bring to our table. That's the food we give to our children. That's the food we give to our family. Get together at dinner and then say, let's talk about this. Let's see what you know. Let's see what you know. Let's see where we can buy better foods, where we can have free range eggs, where we can find organically grown things which are local, which are seasonal, etc. And let's start eating better because we are going to feel a lot. There's a challenge. For
Yeah.
example, I forget the name of the town. This was in the United States. The whole town decided they should lose like I don't know, like thousands of pounds. So the mayor of the city and the management of the city decided to provide information to people, to have nutritionists visiting people, to talk to independent families, and all together lost thousands of pounds. So we can do it.
Yeah.
We know we can do it. And what are we going to get? We're going to get a longer, healthier life. And the same way we plan financially, because we say, well, I'm saving, I have my 401k, I have my retirement fund, I have this, because so many years from today, I want to be in better off and be able to travel and be able to enjoy. And what happens is that so many years down the road, we're sick. And all
Hmm.
those assets are going to be used to solve a problem we have created.
Yes.
If we learn to take care of ourselves and we plan our health, those assets are going to be for traveling and for enjoyment, which is what they should be for. And we're going to be better focused. We're going to function a lot better. You were mentioning, and I don't want to leave it out because it's very important.
Yes.
Mental fogginess.
Yes.
A lot of people complain of that. If you have that, you have to be careful because that's an early symptom of something that could be more important. Magnesium should be my first answer. And as I was telling you, at BioCare Hospital, when our patients come, we check for all these things because we want to target the deficiency that we can supply. Magnesium is inexpensive, it's easy to get, it's everything. Why is it very low in America? It's probably the number one mineral deficiency in America because we don't eat greens. We don't eat chard. We do not eat artichokes or spinach.
Yeah.
That matter. We don't do so many simple things we used to do. And now we have to supplement. But let's do it. Fogginess, if you start supplementing magnesium to good level, it might be going away. But don't disregard this symptom. It's
Yeah.
important that you regain your focus and your mental clarity.
Now, before we move on, I just want to let people know that you're watching a live broadcast over our social media. This is with the BioCare Hospital. They're located in Tijuana, Mexico. And you have we have these guys on every week, twice a week on the radio, so you can hear their show, which is hosted by Dr. Rodriguez, and that show is heard Friday nights at 7 p.m. Eastern time, and then that show replays the Saturday morning at 9:30 a.m. Eastern. So if you want to hear the show, that's when you tune in. And just to be clear, we broadcast 24 hours a day radio, and you can listen to us a number of different ways. You can contact us at contact@truthbetoldnetwork.org. Again, contact@truthbetoldnetwork.org. I can send you an entire listening schedule, and also we broadcast over every single smart device in the world. So you can listen to us over your Alexa, over your Siri HomePod, over your iPhone, over your Android phone, over your Google Home device, and it's very easy to do. We're also on about 15 or 16 different aggregates for Wi-Fi radios. We're on the MyTuner software. You can download that for just about any type of device you can think of, and that'll get out to you so you can listen and you hear great shows like this on the network. And I want to get to a few more of these questions that came in. We have people listening all over the U.S., England. And there's a few others that came in. And what I'd like to do is they have a question here. They just wanted to find out some ways of dealing better with arthritis. So why don't I go to Dr. Ortega? What are your thoughts on that to try to get you involved back here in the conversation about arthritis? What are some of your thoughts about that? And doctors, after she's done, anything you have to add, please do.
Well, arthritis is an autoimmune disease. That means that in a certain way, your body is attacking some cells, and that's why you're having this inflammation. But what we can do about is what we've been saying through along all the program. Look for anti-inflammatory diet. Mm-hmm. We're saying a lot of that, but I think that starts there.
Yes.
Try to increase more of your vegetables, fruits, and not to go on red meats. As much as possible as you can walk or do exercise. If, like Dr. Vasquez said also, if you're overweight, if you don't move, we'll try to do it progressively, in order to not atrophy your joints. Also, if this is a chronic illness and then this of the preventive things that I'm saying, they don't work, we'll just try to look for, you can call us and we can answer some other of your questions, or look for a local doctor to see if that is your certain diagnosis.
Excellent. Does anybody have anything else to add on that subject?
Well, I know arthritis because arthritis is part of aging. And
yes.
I wake up myself with a new pain, a different pain every day, in a different joint. So it's part of the aging process. Of course, your body weight has to do something with it. So try to stay into your normal body weight according to your age, your frame, and try to stay on your weight,
Yes.
or reach your ideal body weight. Measure your the abdominal girth, circumference. Measure it just above the navel.
Hmm.
In men, it should be not more than 101 inches. In women, it should be less than 87 inches. So try to reach that goal, because the abdominal circumference is a factor for chronic inflammation, for cardiovascular disease, for cancer, etc. Well, arthritis. Arthritis just means inflammation of a joint. So it can be due to because you hurt yourself, you had an injury, or because you're aging and the body, the joints degenerate because you lose calcium, you lose magnesium, you need magnesium. Maybe Dr. Rodriguez was
Yes.
talking about that, because you're not. The other is because you're in menopause. It's actually part of the menopausal syndrome, but it's called osteoarthritis disease. It's a chronic degeneration of the skeletal system. It happens to women and it happens to men also,
Yeah.
with the decline in the hormone activity and with the aging process. And rheumatoid arthritis is an autoimmune disease that requires a specific therapies. But I want to tell the people that are listening to us, don't get married with the diagnosis. Osteoarthritis, we all
Yeah.
have a little bit of it or a lot, but we can do a lot of things to handle it. And rheumatoid arthritis also has a specific treatment, but don't get married with the disease. Why? Because arthritis does this: ups and downs. It has a
Hmm.
crisis. You overcome the crisis, maybe take an anti inflammatory, enzymes, antioxidants, come to our clinic, oxygen therapies,
Yeah.
fasting. Do fasting one day of the week will definitely get our defense system against that type of inflammation going. Taking some kind of supplement for cartilage, like chondroitin sulfate,
Yeah.
and things like that. But don't be aggressive. Don't take a pill every day. Just know that you're suffering from that, but that the pain comes and goes. So we don't have to take a treatment
Yeah.
chronically or get uh, more toxins in our system. Try to handle it with a diet, exercise, drinking water, checking your bone health with bone density,
Hmm.
checking that joint that hurts, if there's anything else that we can do, local heat, and of course, use a vacuum cleaner. That's
And
very
not the
important.
robotic one.
Yeah,
Yes.
we all know that. As I said, there's a new pain every day. But as we get out of bed and we start moving, the pain goes away. Our body's telling us
Yeah.
something: move, move,
Yeah.
because that will make a
Excellent.
difference. Uh-huh.
And let me do this. I have another question that came in, and I think I will, Dr. Vasquez, I'll start with you. The person wanted to know best ways to boost the immune system.
Okay, the best way to boost your immune
Yeah.
system is
Yes,
start
sir.
with diet. Okay, as well for supplements like omega-3, uh, uh, antioxidants will help. And very important to walk. It's very important what Dr. Romero says, to do exercise, because
Yeah.
by doing that you're promoting elimination of toxins out of your body. So as more clean the body, you will have a better immune response because your body's dealing with less toxins inside of your body. Well, I will
Hmm.
say, as to summarize diet and supplementation, one of the vitamins that I want to mention that has a very important role in helping your immune system is vitamin D. Vitamin D is a tremendous or and helpful vitamin that support your immune system by reducing the inflammatory process. Uh, in vitamin E, vitamin A, etc.
It's excellent. Also, I know, I believe zinc does some wonders too.
Absolutely,
Uh,
it's trace. Zinc belongs to the group of minerals called trace minerals. So magnesium as well. So I definitely will recommend these supplements for these patients.
Excellent. What other doctor would like to comment about best ways to boost the immune system?
Well, there is a word, a fairly not new, but we're reading a lot of something called, and the people can look, Google it, immunosenescence.
Okay.
Immunosenescence is the word that means immune system getting older. It doesn't get younger; it gets older along with us. So, what happens with immunosenescence? When the immune system gets older, we start to get sick.
Hmm.
But we can do things about that. What keeps the immune system younger? What rejuvenates? What would you say that rejuvenates the immune system better than anything else?
I'm not sure. What would it be?
Move, as I told you
Move, huh?
before. Use the vacuum cleaner. Keep
Use the
using
vacuum
the
cleaner.
vacuum cleaner, and come to our clinic. Come to our clinic.
Yes.
We'll definitely tell you a lot, give you a lot of ideas. But move and keep that healthy diet. Stay. I always tell my patients to watch uh, white color on what they put in their mouth. Avoid
Hmm.
everything that anything that's white. White
Hmm.
sugar, white flour, sodium. Sodium is the number one cancer producing agent in the world.
I didn't know
Sodium.
that. That's
Stay away
interesting.
from sodium. You will find it in even ice cream has a load of sodium. It's loaded with sodium. Sodium is used as a preservative for food, a conservative. So
Right.
everything has sodium in it. Even frozen vegetables, they have sodium. So white sugar, salt or sodium, white flour, white rice. Watch it with the potatoes. They're not that bad, but I have a thing with potatoes. They're for me they're not a very good carbohydrate. But anyway,
Yeah.
those
Well,
are
it's
the main
interesting
ones
too
are
because the
mhm,
it's interesting because the potato is actually in the nightshade family, which
right.
I only found out maybe a year or two ago. I thought that was pretty interesting.
They are.
Yeah. So please continue. I did interrupt, but please
No,
continue.
just stay away from the white stuff. As I said, white flour, white sodium, sugar, definitely. I think those three are the main ones. So
Okay.
stay away
And
from
I
that. It will
I
make a difference.
I would
And if
like
you decrease the sodium intake, it will help also your aching joints. It can make a
okay.
difference.
And I think Dr. Ortega, you wanted to jump in here real quick. What did you want to add?
Well, if you drink alcohol and then if you smoke, I think you need to, take it out from your lifestyle. That I think that can help also to increase better or healthy immune system, and try to rest. You also need to sleep. So I
Mhm.
think adequate sleep will also will be part of your healthy immune system.
Excellent. And let me stay with you for a moment. And this is the last one that I have that came in the last question. They wanted to know about brain health and some things that they can do to help their. We did cover it a little bit with Dr. Rodriguez before. I didn't have that comment that came in. Maybe it's because of what he was saying, but they just wanted to get more information about better brain health.
All right. So I'm going
Add,
to stick with Dr. Romero's answer. I think staying
yeah.
away from sugar or hypercaloric diet, which also means a lot of carbohydrates or not good fats, can help a lot to be in a better brain shape. So less sugar or no sugar is the best for brain. Trying to do some other activities that will lead to brain exercise. Probably write down, read books, and also do exercise, walking, getting, lowering your stress levels. One of them is walking, doing exercise, finding some other activities, yoga, probably, bicycle. You liberate stress, liberating stress, then inflammation goes down. So I think those are the purpose, the objectives.
Yeah, what's interesting is where I am. I'm in the Danbury, Connecticut area, and near us is a very large mall. It's called the Danbury Fair Mall. And from almost the day that it opened, what's interesting is mostly older folk. The mall, just to give you an idea, it's a half a mile long. It's 1/2 mile. So if you walk down and back, you've done a mile. So they know exactly how far they've walked, and they actually have a walking club. So one thing I'm thinking of as you guys are talking about walking and exercise and moving is find out where you live. You can, talk to the people at the mall there and see if there's a mall walker. They call them mall walkers, a mall walking club, because you have a nice, safe, enclosed environment. You can, in the case of the Danbury Fair Mall, it's the second largest mall in the Eastern Seaboard from Maine to Florida. And like I said, it's a mile if you walk one lap. So they know how far they've walked, which is kind of cool. So Dr. Rodriguez, I wanted to get back to you real quick. I wanted you to let people know we've talked about a lot in this broadcast, and how can people best contact your facility, the BioCare Hospital in Tijuana, Mexico, to find out more information about what you guys do and how you can help them?
Well, I would encourage everybody to go to our website, because we have a lot of information. We're always broadcasting information about all sorts of issues. So you can go to biocarehospital.com. We also have a toll-free number. So if you want to ask a question personally, like for example today with Dr. Vasquez, when he says, how old is this person? You can call us at 800-701-7345. You can.
Can you repeat that number?
Sure. It's 800-705 800-701-7345.
701-7345.
800. Now, we're in most, or I would say every social media, like Facebook, Twitter, Instagram, YouTube. We have videos on conferences. You can listen to all our broadcasts that we have done with Truth Be Told Radio Network. If you search for Truth Be Told Radio Network in Spotify, and you're going to have over 100 hours of programming that you can listen to. So, and the other thing that I always encourage people to do is ask questions. There is not such a thing as a dumb question. There is not such a thing as, well, I don't feel good about asking. You cannot know everything. Nobody knows everything. So ask a question. And I promise you that I will get right back to you personally as soon as possible. That's normally within 24 hours. So you can ask your questions in any of the social media or on our website and on Facebook, on Twitter, on Instagram, and I'll be very happy to answer. There is no strings attached. You don't have to give me your name. There's not going to be any charge. And also, if you know anybody that could benefit from this, give them the number, give them the connection so they can ask a question. Because the more we know, the better level of education we have on this, the better off we're going to be, the healthier we're going to be. And believe it or not, if I want to see you in this hospital, is because you're doing BioCare Getaway because you want to be healthier, just like Dr. Mer was saying, because you want to do something that's going to be preventive. I don't like to see people that are sick, much less when I know if I had seen them 10 years ago or 5 years ago, they would not be under these circumstances. So please contact me, please learn about it. There are many resources on the web and learn and talk about it with your family.
Yes. And one thing I was hoping you could do is tell people about chicken soup.
Okay. Well, I always say chicken soup is as good as your grandmother told you is. And it is really a clear picture of what has happened to our food. Number one, we used to have a free range hen that was roaming around, eating everything it should eat, having fun, etc. It was a very healthy, happy hen. And then when we were going to prepare it, we were never in a hurry. We would have the whole chicken, and then the way I do it is I put carrots and probably some other vegetables like celery and so on. And I put olive oil, which, by the way, an ounce of olive oil a day is going to do wonderful things for inflammation. So I put it in olive oil and just kind of make a light fry of that. Then I put the chicken, do the same thing, kind of searing the meat, and then I put the water and I let it boil very slowly for a long time.
Hmm.
First of all, you're putting the whole chicken, skin and bones, because all of them have nutrients. The bones, in particular, have very important nutrients. Now, if I don't do this, I'm going to be missing very important nutrients. Then the bones are not as easy as to just be there and they're going to release all their treasures. No, they have to simmer for good 2 hours, 3 hours, or even longer if you just lower the heat. So at the end, you're going to have a very rich broth. You don't have to eat parts of the chicken you don't like. You don't have to eat the neck or the feet if you don't want to, but your chicken soup is going to be rich. The way we do it today is we're going to buy a chicken that from birth to your plate, it probably had only 12 weeks. Then you skin it. Then you bone it. Then you put some of the meat and you call that a chicken soup? Think again. By the way, the recipe is in our Facebook page, and I'll be very happy to share not only this, but many, many recipes. We have lunch together, the doctors and myself. We talk to the kitchen personnel all day long. Our kitchen is 7 times the size of our pharmacy because we truly believe, you probably have seen that over the course of this broadcast, we truly believe that by managing food which is within our reach, we can change immunity, we can change weight, we can change diabetes, cancer, heart disease, etc. And of course, looks, because healthy is beautiful. So be
Absolutely.
healthy, it pays to be healthy.
Yes, and what I wanted to ask the doctors right now before we're going to wrap up very soon, I wanted to make sure that if you had any final thoughts, anything you would like to add for the people watching and listening at home, I will start with Dr. Romero. And Dr. Romero, what final thoughts do you have for us?
Invest in your health. That's your best investment. Investing in your health. That's it.
That's it.
Work
And
out.
yeah, yeah. And Dr. Vasquez, what are your final thoughts for the viewers and listeners?
Eating an apple, keep the doctor away. No, It is very important what Dr. Romero says. Invest in your health. And basically, she's talking about doing prevention programs. You don't
Yes,
have to wait until disease hits you. You have to, especially you know that you are exposed to pollution or having some health issues, borderline high blood pressure or diabetes. So let's move ahead and start treatment because that will prevent you to have the complication of these devastating diseases. Uh, and,
absolutely.
and just to finalize, we're talking about a diet here, and I would like to say that our kitchen, our food, is as important as the pharmacy. So be sure that you're going to have a good nutrients, good food here to help you.
Yes, and I guess the old adage, you are what you eat, is very true.
Yes.
Yes, and Dr. Ortega, any final thoughts, please?
Well, agreeing with the other doctors, being healthy or trying to stay healthy and prevent a disease will get you to a happy aging, and happy aging will seems like you will have time to travel or look around without having any or pain or any incapable of not doing something else. So do it as when you're young instead of when you already have a disease.
Yes, and thank you very much. And Dr. Rodriguez, let's go back to you. Why don't you let people know a little bit about the hospital, how they can contact the hospital, if there's an email address, website, etc.
Excuse
And
me.
there
Yes,
you go.
you can contact us through email, through social media, or through toll-free numbers. So how you do that? The toll-free number, we already talked about it, 800-701-7345. Then we have a very simple email too, is doctor. Spell the
Hmm.
full word, DOCTOR at biocarehospital.com. BioCare, B as in boy, I-O, care, hospital.com. And then in social media, in Facebook, in Twitter, look for BioCare. You can look for BioCare Hospital in any of these platforms, and you're going to be able to get messages from us. You're going to be able to ask questions. And don't miss the chance of a free phone call without any compromise to talk to any of the doctors. You might say, I know a person that has breast cancer, and I think what Dr. Romero said makes sense. I like what it is. Don't miss the chance to talk to her. It's going to cost you nothing. You have a toll free number. You call, you can say, I want to talk to Dr. Romero, and you can just tell her, I heard you on Truth Be Told Radio Network, and I have several questions, or I have this particular case. We get all sorts of questions, from very simple to complicated cases in which guidance and
Yeah.
help and support are very important. So don't miss the chance. Pick up the phone, ask us a question. We're going to have an answer for you.
And also let people know what they can hear, what type of subjects, etc., what they can hear on your radio show on the Truth Be Told Radio Network. That appears, like I said, Fridays, 7 p.m. Eastern Time, Saturday mornings, 9:30 a.m. Eastern Time.
Well, Kevin, we have over 100 hours of programming, so I could mention so many things: Alzheimer's, diabetes, food, intestinal flora, uh, well-being in general, physical activity, supplementation, minerals, vitamins, you name it. There are so many subjects. And the most important thing is if you search for Truth Be Told Radio Network on Spotify, you can select different programs, select different parts of it, and share them with people you love. Share them with family, share them with neighbors, with co-workers or church members, and say, hey, listen to this. What do you think of this? Start a conversation. It can only do good to you because once again, you can change your life for better. So
Yes.
don't miss this opportunity.
Absolutely. Dr. Rodriguez, Dr. Ortega, Dr. Vasquez, and Dr. Romero, thank you so much for joining us here tonight. I really do appreciate it. Look forward to this, and hopefully we'll get you back on in another 2 months, and it'll be in November. Be a lot to talk about. And folks, I thank the doctors here, and please, when you get a chance, listen to the show and be able to contact them with your questions, concerns. Some great people at the BioCare Hospital. I'm Kevin Gallagher, and as always, you can listen to the Truth Be Told Radio Network. You can listen on almost 5 billion different smart devices, from smartphones, your Alexa devices, Google Nest devices, and also the iPod, iPhones, etc. And you can listen just by saying the name of the network and the keyword. That is one of the best ways that you can listen. And if you have one of those devices, great. You have access to the network and can listen to Dr. Rodriguez's show every single week. Folks, I'm Kevin Gallagher for the BioCare Hospital. I thank you so much for joining us here tonight.
Thank you very
Please
much.
Thank you.
Please tune in again. You're very welcome, guys. You were fantastic. And folks, if you got questions, go to biocarehospital.com and you can get your questions answered there. If you have questions about the radio network, contact at truthbetoldnetwork.org. That's contact at truthbetoldnetwork.org, and you can get a listeners list sent to you that has our whole listening schedule. And folks, thank you very much. We'll be talking to you again real soon. I'm Kevin Gallagher, and have a blessed night. Bye-bye.
You too. Thank
Bye.
you.
Bye-bye.